COVID-19 Financial Oversight Committee. We are grateful for the time you will spend to provide guidance not only to Metro, but also the impact it will have on our community. So thank you. We've got a lot to cover in a short time, so we will move right ahead. But I would like to go around with introductions and just make sure we know who's here today. So I will start. Mary Jo Wiggins, and I am the Finance Deputy Director. My role predominantly related to this CARES Act funding has been that as we'll talk about, Metro has received funding from the CARES Act under many different funding sources. And so a way to make sure that we are tracking it all, that we are optimizing it, I have just been working with the departments and all of our related agencies to make sure that we're aware of what is eligible to Metro and how can we spend these funds. So with resource from our legal department and other guidance, we continue to make sure that we do the best we can with these funds. So that has been my role related to CARES Act. And I'll pass it over to Ashley. She's going to control our microphones today too. So.
Hey, I'm Ashley Warrington. I'm the representative from the mayor's office.
Yeah.
Sean Henry, National President.
Sarah Finley, I'm corporate board work and one nonprofit. Wanda McCain, Central Labor.
Johnston, district councilperson.
Andrews.
Renato Rebecca, a lawyer here.
Principal at Coast Development. Past several years, I've worked on capital projects for the city of Nashville.
Harold Love, State Representative, District 58.
Thank you all. And
Alex Dickerson, Metro Legal Department Attorney.
fantastic. And the first thing I'm going to do, since many of us are not accustomed to public meetings, open meetings, is just to have Alex explain that a little bit for us as we move forward as a committee.
Afternoon, everybody. Just a few things. Because you all are a governing body, the state legislature has determined that all meetings that you have to be open to the public. The reason specifically that you're a governing body is because you all make recommendations to another public body, in this case, Metro Council. Now, what does that mean for you practically? It means that for all in-person meetings like we're having today, they have to be open to the public. So if there were members of the public here, it doesn't look like we have any, but they would be sitting in the gallery behind you. In cases where it's a virtual meeting, if we're ever in a place where we have to do virtual meetings instead, that would need to be live. It would be basically broadcast live on Metro Nashville Network or the YouTube channel. It also means that, and this is perhaps the most important part, when you are outside these meetings, you can't have any discussions with any fellow task force member about anything you are currently voting on or could possibly vote on. So now, does that mean that if Representative Love and Councilmember Johnston run into each other in the grocery store, that you have to run screaming away from each other? No, it doesn't. You can have conversations about anything else, just nothing that you do related to the task force. So the consequences for violations of this act, or that anything that the task force does, would be declared void by a court. So it's pretty heavy penalty for doing so. So we just ask that any communication, be it in person, email, anything like that, prefer that you do it during the meetings. And if you have any questions because you have some type of interaction, you can contact Mary Jo and she'll ask me and we can talk about that also. So those are the basics. Any questions about that? All right, thank you.
Okay, so one of the things we will do before we leave today is get an idea of what our regular meeting schedule will be. That will make it a little bit easier for us to get in routine and know what we're going to be doing. As a reminder, the scope for this committee, really our purpose is for you all to collect, consider, and recommend the appropriate uses of all federal and state funds provided to Metro for COVID-19 relief and recovery, including but not limited to our federal CARES Act funds. So some important dates, and we'll start to talk more about that in detail, but our initial recommendation to the mayor, the director of finance, and the Metro Council shall come not later than August 3rd. So we really are on a pretty quick schedule to make that initial recommendation, And therefore, today, we really want to set the foundation for what are the options. We hear a lot about the CARES Act. I've spent a lot of time through all of the different funds and eligibility, and will share with you and answer questions that you have to go through all of the different guidance, which will start to give you an idea of forming some idea of where that funding could go. And then we'll talk about some other milestones and some key dates. So again, we'll go back to that guidance. I will walk you through the funding that Metro has already received or will be receiving. It's been identified to us. We have incurred expenses. Of course, we've been responding as a city to the public health crisis. So I'll give you an idea of what those expenses have been, what the estimates are to date, all the way through the end of the period for which those expenses would be covered, which is currently December 30th, and we'll talk about that. And then a really important partner that will help some of this guidance is Equity Alliance. So I'll walk you through a recent contract with Equity Alliance and what they'll be providing to Metro, which will also be an important tool for you. So that's our agenda today. And I will jump right into guidance unless anybody has a question before then. Okay. So there are two pieces of information that really provide the guidance. The original guidance, you have a hard copy. It was dated June 30th. The information is all on the U.S. Treasury website. For local, for state, territorial, local, and tribal governments. And I'm just going to boil it down to there were three basic rules. That the expenses had to be unbudgeted as of our most recent budget, which was FY20. They had to be necessary to respond to the public health emergency, and they have to be incurred between March 1st and December 30th of 2020. Those are the three basics. They didn't give us a lot of additional guidance when that first came out, but they have since added guidance through FAQs. So we'll switch to the FAQs, and I'm really just going to page through it in the sense of I'm not going to stop at any of the additional questions. If you read any of it before and you have a specific question, I'm happy to address it. I really just want to give you the idea of what is eligible.
Just really quick, because the first question is, are governments required to submit proposed expenditures to the Treasury for approval? It says no. So if we spend money, if we're not making the proposal, like who's the police?
Yes, no, it's a great question. So we did not actually make an application, and that's a great point, and thanks. Let me backtrack a little bit. When the CARES Act was announced, we are grateful that Nashville, because of our population, it was for cities over 500,000, we actually received a direct allocation. So Nashville and Memphis are the only cities that received that direct allocation in Tennessee, and we did not apply. So it was simply a formula based on population that we received the $121 million. It's $121,122,775 to be exact. And those funds were received through a certification by Mayor Cooper saying, we will only spend these funds in accordance with the guidelines. And there is, some administrative answers in here for us, but essentially the police, as you ask, is the Office of Inspector General. And we are subject to an audit of those funds at the time that they announce they are arriving. The funds are also subject to our audit of our single audit of all federal funds received. So that single audit requirement will kick in, for fiscal 20 and 21 as we incur those expenditures. So our external auditors will also be auditing in accordance with the guidelines. If it is determined that funds were spent not in accordance with the guidelines, they need to be returned. So the funds have been received. They were received, I believe the date was April 17th, and they are sitting in an isolated account, one that we set up strictly for those funds. So they are still all there based on approval and allocation by the Metro Council. Yes. Yep, and I actually have that specifically highlighted. So we will go through, there are some funds that the Metro Council has already approved for allocation, and we'll walk through those. Okay, so the general types of expenses that the city has been incurring are, PPE, cleaning, sanitation, all of the different supplies. We have 2 different shelters to serve our homeless population. So temporary staffing and the supplies and meals to take care of those shelters. As you're aware, we have the testing centers, so temporary labor and all of the supplies to run those centers. All of those types of costs are covered, as well as you can see, plexiglass. There's a lot of plexiglass installed around Metro and its public buildings, along with signage. Anything that we needed to do to current workspace or public buildings in order to make sure that we were a safe distance and could protect the public as they come and need to interact and as we provide those services. So those are the types of expenses that internally. Now, the other piece that helps us is as we've incurred overtime related to COVID. The overtime for our public safety personnel and our public health department is eligible for that reimbursement. So again, the idea is that we didn't anticipate the pandemic, and so the extra expenses that we incur are eligible. Our regularly budgeted expenses are typically not available to be charged to the fund. But then as the guidance goes through, there are a few exceptions. And so we did have the opportunity with the shutdown, our parks weren't open, our libraries weren't open, our school nurses weren't in schools. A lot of the staff, they were repurposed delivering food to our MNPS students. The nurses were working the hotlines or at the testing centers. We had folks from other departments, such as social services and the fairgrounds, working at the shelters. If we had staff that was substantially repurposed, we were able to charge their regular time, not just overtime, to the COVID fund. So, and then in addition to the repurposed time, sick time. So if we had to provide additional administrative sick time for somebody to quarantine, to be with a family member who needed them for taking care if they were COVID positive, those types of additional expenses. So that gave us a little bit of some of that regular funding that they were no longer doing their normal role. So we were able to charge that to the fund. Some of the questions that then really come up is we do have the ability to provide economic support to the community. It can be to individuals and it can also be to small businesses. And that we can have a nonprofit or another third party administer those funds. The administrative costs to administer those funds are eligible. And the small businesses and the individuals that would receive any kind of grant or financial assistance, they do need to have been related to COVID. Unfortunately, we know there was a lot of need prior to the pandemic, but the needs do have to be related to COVID.
Do we have to ask?
I don't believe that is a requirement.
I also have some of the stuff that we're talking about, the areas served outside of the county.
No, so the United Way has a separate COVID-19 fund, and those were all public donations. The donations, they collected close to $5 million. That had nothing to do with any of the federal funding. They distributed those in grants to nonprofits, and they serve a 5-county region. So those were their funds to distribute. and they didn't have the same federal requirements. I did provide that list so that you all could have an idea of some of the nonprofits that have already been receiving funds, but they are under a complete different set of rules and eligibility. So that's why you'll see some other counties, because they actually serve a 5-county area. Okay.
Earlier that the funds have been received, most of the funds have been received since April. Does that count a interest-bearing?
It is.
If so, are those funds held to the same standard?
Say the second part.
If so, is the interest gained on those funds held to the same standard?
Yes,
Allocation?
interest earned on the funds in the bank actually have to then also be spent under the same regulations. We wish it was going to be more interest, but we'll take every little bit we can. There's another item that you will see when we talk about some of the expenses incurred. The fund does allow for hazard pay. So for our critical infrastructure employees who are repeatedly exposed to the public and in hazard of the virus, they do qualify for hazard pay. A common question that we've had is we cannot make prepayments. So we could not, because of the current expiration for the expenditures is December 30th. If we have expenses that go beyond December 30th, we cannot prepay them in order to hit that December 30th deadline.
Hey, real quick, if you guys, when you ask a question, if you'll pick up your microphone, that way it'll get recorded later.
Do you want to re-ask
Yeah,
that?
my question was, who all is included in critical infrastructure employees?
So the critical infrastructure employees cover predominantly our public safety, fire, OEM, sheriff's department, police, and then also our public health department. But there are also other critical infrastructure employees that go all the way to public works, general services, our codes, our inspections. They are defined as the employees that must be working to make this city work. So the employees first have to meet that requirement. Then they also have to be in direct response to COVID-19. So not all of our critical infrastructure employees met the definition of working in the face of the virus. One other item you'll see later in the list is also that any interest from tax anticipation notes. So that's an item that you'll see in the list, and I just wanted you to know that was specifically in the guidance. The tax anticipation notes, TANs, that Metro has a form of debt, that interest is eligible to the fund. We also then can incur expenses that we believe will address the ongoing current pandemic. So again, all the way until December 30th, the expenses that the city expects that it needs to incur that are necessary to the prevention of the spread. An important piece of this coronavirus relief fund that is different than ever has been is that we can use it for our matching to a FEMA claim. So we currently have 3 different FEMA claims because of the tornado on March 3rd, the straight line winds on May 3rd, and then of course this virus, the pandemic. Only the FEMA claim for the pandemic can we use these as matching funds. But in Tennessee, that's roughly 12.5% of our claim. And so we will use some of our fund to pay for that matching. Those are the big items. Again, you've got, I think it's 9, 10 pages, 11 pages of FAQs. If you run across one that you have a question, just please let me know.
Edward, you can go ahead.
Yeah, Marriage, I have a question
Yes.
for you, and I don't expect this to be a specific answer, but you mentioned early on how certain employees had been relocated just as a response. Do you think that the city is experiencing in any way, form, or fashion a shortage in terms of employee or staff that could be committed to certain emergency responses we deem necessary? And if so, is there a training programs or hiring effort that's going on currently?
For the employees that were repurposed?
Just for positions, period. So we talk about firefighters, nurses, school nurses, example you used earlier. Are we experiencing a shortage, or could we use more capacity in those areas? And as we prepare for potentially more cases?
Yeah, so one of the things, the importance of that hazard pay that I talked about in being eligible is that we want to provide that so we don't lose that critical public safety need. We have not experienced any higher than normal turnover because of the pandemic, which is certainly a concern that we would not be able to respond to the needs. And so we have been able to meet the needs. We have not had an increased turnover, and the additional hazard pay is part of that. Councilmember Johnston.
Have we looked at, so like this repurposed time, for example, that's money that comes out of the operating budget anyway, but we're able to reimburse it because they're doing something else. Mm-hmm. So it obviously has an impact to our operating budget. Have we done an analysis to see what things like that, and I'm sure there's other examples of things, that will affect and alleviate some of the operating budget? Do we know that number?
The combination of the sick time for those that had extended sick time due to COVID and the repurposed employees currently is running about $1.6 million. And that's an estimate all the way through December 30th. So that is that is not through December 30th. That is through June 30th. So most of our departments are back and fully functioning in their normal role. So we don't know that will increase dramatically. There could be some increase over that $1.6 million that was only through June.
And is that the only line item that would affect the operating budget, or are there other examples?
That is the primary line item.
Okay.
There are eligibility, there are public safety salaries that are eligible. So you will see in the guidance, it talks about payroll expenses related to public safety and public health employees who are substantially dedicated to the mitigation of the virus. That could be interpreted to use their entire salary, regular time also. That would be the most significant benefit that we could have on our regular FY21 budget.
And so when we have this effect to the operating budget, which would obviously have expenses lower and or revenues higher, however you want to look at it, how are we reflecting that? Where is that extra money going?
Well, to this point, only that sick and repurpose time has really been addressed. So we're looking at that $1.6 million. That is something this committee will have, will provide that recommendation to say, okay, we'll go through some numbers, but we've got money that we need to decide, do we want to charge more public safety salary to the fund and therefore relieve more of the budget? Do we want to put more money into the community for individuals and small businesses? You'll see some other requests are within the Metro Department, some additional work that we think is eligible under the funds, but may not be the largest priority. And so that's what this committee will actually give us, that guidance and make that recommendation on what they think is the best use of the funds that are remaining.
Mary Jo, the second part of my question, I think you did a great job answering the first part, but in terms of potential needed capacity, has there been identified opportunities or training programs? And the reason I ask specifically is because while we are in unfortunate times, I think it creates an opportunity for a lot of people to gain further job skills, and a lot of people who are experiencing unemployment or underemployment, while there is some hazard to it, may be interested in opportunities helping the public, gaining training. And I think we're in a time now where if they're able to gain that training in the next 6 months, COVID doesn't go anywhere, and it will empower them to get jobs later and continue to help either this city or move to other locations. So I'm just curious if there's maybe a department by department or just a general list of different types of roles. I understand you can't go from being not a nurse yesterday to being a nurse.
Right.
But if there are certain positions that may have
So
low barriers to entry, I think we should, if we could get a list of those, I think that may be something that would be helpful.
Well, until recently, Metro had a hiring freeze. So there weren't internal positions. It was really a repurposing of the employees that were already here at Metro. So from a training perspective, I think one of the things, if I understand, more of a workforce development training program, and outside of Metro, that could be a community support for individuals that lost their job during the pandemic. If there is an opportunity for them to build new skills and have something that then makes them more employable because they lost their job during the pandemic, that would be a type of community support. So I think, if I'm understanding your question, the answer is more about what can be done for the community and workforce development, more so than the internal employees that were repurposed, because they went back to their normal recurring role.
To the helping just the community at large, but also, I mean, I was well aware of Metro having a hiring freeze, but I would assume now, under these circumstances, if you have a certain skill set that would be helpful, you would circumvent that hiring freeze. And so I'm making an assumption, you can correct me, but I would assume the hiring freeze for those potential jobs that are in high need or in high demand is now no longer relevant, and we've hired people who would be helpful. I feel like if we evaluate and think there's more capacity, is there a way to continue hiring people with the understanding that it may be temporary because we're utilizing these funds, but they now will have the opportunity to gain a certain skill set?
Yeah, so most of the gap in labor has been filled through temporary contract labor. So those folks, we needed folks who already had that skill set or who could be trained, but you're right, but they were getting that training, but most of those folks were not Metro employees. It was through temporary contract labor.
In the mayor's letter dated May 19, 2020, there was a total of $38,852,000, I guess, that was determined expenses for staffing, hazard pay, PPE that have already been expended and estimated, paid out of the existing Metro funds. Are we looking at also including that for reimbursement out of the CARES Act, or has that already been done?
So of that $38.8 million estimate for the city's public response, 16.7 is what was approved by the Metro Council last month, I believe. There are two totals. There's two spreadsheets in your packet. If you'll go to the total funding of the CARES Act, I'll go through this quickly. Yes. It says CARES Act funding at the top, and it starts with the state and local coronavirus relief fund, which you'll often hear us say is the CRF. The CRF is the $121 million that was received by Metro. So it is only one bucket of funds under the CARES Act. What's in this list, and I apologize it wasn't printed in color, but you can see the darker color is state funds. So if you see the darker color, that is the state's funding that they received. And whenever there was something that was identified to be received or already received by Metro, it's in that lighter shade. And so you can see that in addition to the $121 million, MNPS has received what will net to $23.7 million. You may be familiar with more of a $26 million number, but that was for Davidson County and included any of the private schools, the non-public schools that applied. So we believe that the 23.7 is what will be to the benefit of MNPS. And then you can see some of the programs. There is some support for Head Start. Some of our other community service block grant funding will go through our Metro Action Commission. There is some funding. You'll see that $1.5 million for the police department. That was a JAG grant. It is 2 years. It does cover some payroll, as we pointed out, there are some small pockets of exception. It is predominantly for PPE for our police officers. The Department of Transportation, that $75 million is the total of those three numbers you see. And that benefits MTA, RTA, and is also a portion for Franklin, Williamson County. It flows through the RTA, so that's why you see that. It is properly allocated to that Franklin, Williamson County area. But those funds are available for operating to make sure that they stay at their pre-COVID operating levels. It also allows for some capital expenditures. And so you may be aware we did use some of that funding to supplement the subsidy that Metro typically would provide to MTA, RTA. So that was incorporated into the FY21 budget, a portion of that. There are a couple smaller grants to our Metro Arts Commission as well as our public library. And then you'll see a significant amount of funding for HUD. And that money actually is managed in partnership with MDHA. And in general, those funds are available, especially the Emergency Solutions Grant. That is predominantly focused on our homeless population. So we have been fortunate enough to have somebody from HUD providing the technical assistance to develop a comprehensive plan to really address a lot of the homeless issues in Nashville, particularly with the populations being served at the Fairgrounds Shelter and the Municipal Auditorium Shelter, and to make sure that we get those folks rehoused by the end of this pandemic, or at least by the end date of our funding. And each of the different funding sources have different dates, just to further complicate things.
So I have a question about that. So
Use your, Vonda, will you use your microphone?
any rent relief, I'm sorry,
That's all right.
any rent relief or that wouldn't come out of that bucket?
There is currently there was a public notice. I don't know if the time period has closed yet, but the CDBG funds that were received, that $3 million, that is predominantly being used for rent and mortgage relief. Again, managed through MDHA. Those funds will go to nonprofits that can administer those funds to the individuals that need them. And those nonprofits have been applying through that HUD open application process with MDHA.
And
Representative Love?
All right, thank you.
There we go.
About that particular grant fund, the MDHA application process, is it just for their residents, or can those nonprofits help anyone in the city with those funds?
I believe it's open to residents of Davidson County, not just the residents of MDHA.
Okay, thank you.
I will confirm that, though. Councilmember?
can we have more information as to what that application process looks like?
Yes, I will send a link to this committee. It is from the MDHA website.
Do we have any demographics on that?
The awards have not been made.
Okay.
So is that what you're asking?
Yes.
Yeah, the awards have not been made yet. Okay, and just a few more. In addition to, I referred to the police department received a grant for $1.5 million. Fire also received a grant for $1 million. Again, that is just for PPE. And then the Department of Health and Human Services provided funding to hospitals, different clinics. So Nashville General Hospital has received a total of $10.2 million. And the amount received by the fire department is actually directly related to OEM and ambulatory services and the emergency response. And they're based on Medicare and Medicaid, in our case, TennCare payments that have been received in the past. So you'll see that While we are predominantly going to talk about the $121 million of our CRF, Metro has received $251 million. Not all of that has been received to date, but it's been identified and somewhat committed. And so we want to make sure that we optimize those dollars. They have different eligibility and different timeframes. And so where it's a little bit of a puzzle, where do we see it fitting best so that we free up the most flexible money and then use what we really need to for specific public response related to COVID. And so the piece that's not on here is FEMA. So we can charge a good amount of our PPE, our supplies, our overtime to FEMA. And so that is a little bit of a moving target for us, and it does make it a little bit of a challenge in what seems like a long time, but is relatively a short period of time to know where to put those. So that's where I referred to the Coronavirus Relief Fund allows us to use money to match that FEMA fund. So the more we can find eligible to FEMA, that is kind of that leaves more of the $121 million for what this committee wants to make for recommendations. And we see it as the more of Metro's public response that we can charge to FEMA, the more that we have maybe for community response. Okay. So then let's look, the last sheet on that side of your folder was a draft. And I really I'll walk through the different sections of it, but there has been an interim funding approved by Metro Council. And as we've talked, 16.7 million of that was for the city's emergency response. That is the estimate for the type of items that we've talked about. And you'll see some of them listed that were incurred or estimated that will hit our ledgers by June 30th. Our departments are working fast and furiously to close the books, but it is a big process. Again, particularly in light of the fact that there are a lot of different expenses related to tornadoes and straight line winds and COVID and civil unrest that we are trying to make sure we have properly identified. In addition to that, out of our 121 million, we are providing 24 million to MNPS for laptops and hotspots. And you'll see the reason it says hotspot monthly fees partial, because again, we have the December 30th restriction and we couldn't prepay 13 months of hotspot. So we're working with MNPS and again, how to optimize those funds through the ones that they've received. Representative Love?
I did want to make the committee aware of the fact, you may already know this, but the other committee that I'm on with the state pushed very hard to make sure that we would also provide some support. And so we released, I think, $50 million for a matching grant. So this may help us stretch that, which allows for the state to pay 1/3 of the cost of laptops if the city would pay 2/3.
Yes.
And so I don't know if that'll go into deliberation, but how we can further stretch this $24 million, because I think the 24 is supposed to cover 90,000 laptops and internet. But if we can find some way to be in conversation with Dr. Battle about what it looks like to have our portion of that state match, then that also may free up some more money that can be used for other community support.
Yes, thank you for mentioning that. And that is where, again, that's that optimization of all of the different buckets. And as Representative Love said, there is, the reason that previous list with the additional dollars from the state, that the state was awarded, there are some big numbers on there. And we would love for some of that to make sure that it is, that we are talking to the state, and we are, to make sure that Nashville and Davidson County and our schools benefit from some of the other funding that is at the state level. We're happy to have you here on our committee.
One question on the hotspot equipment. How much of the connectivity issue is addressed by the amounts that have already been allocated, and for how long?
There are 17,000 hotspot units. I believe that was based on a survey of MNPS and the families. I can follow up. There are a few folks working specifically on that. And the current contract is for 13 months.
I was just curious as to whether we consider that issue to be resolved or whether there's still a need there, or do we know?
I believe that was the identified gap by the families as they were surveyed. I will make sure, though.
Can I ask a question about the laptops real quick? I had read that we were having some trouble acquiring all of them. Has that been resolved?
I believe the delivery dates will all be within, for sure, the funding period of December 30th. I think that a model change was made to get them faster. And the last piece that you'll see under the already approved was some other, Councilmember Johnston, you asked a little bit about the impact on the budget. Knowing that we had these funds and that so many of our nonprofits are now serving COVID-impacted individuals and families, there were direct appropriations and community partnership funds. That's what you see as the CPF. Those are community partnership funds. Those dollars would have been in our FY21 budget, but we did not have to put them in the budget because we knew we could fund them through through our CRF, our Coronavirus Relief Fund. So that $2.8 million, though, we wanted to make sure we got out the door to those nonprofits as quickly as possible. And so the Community Partnership Fund process is taking place, as well as the contracting on those direct appropriations. So that 43.5 is the total that's already been approved. What you see in the additional 22.1 million is just the difference between that 38.8 estimate and the 16.7 estimate. So that is just the total that the city still believes it needs for a proper public response to make sure that we can prepare for, prevent, and respond to the pandemic. What follows is the task at hand for the committee, and that is really, as we are looking at all of the different requests and possibilities and different opportunities that we have with these funds. I showed just some quick math. I mean, there's essentially $55.5 million left to be allocated, and you can see without really any kind of open application or request, we could certainly exceed that, double, triple. And so as much of, as it seemed like a big dollar, we know it will go quickly. And those are certainly just bookmarks. You can see I put the question marks next to those economic support and small business grant. That is just simply to give you an idea of the magnitude of what's available or what's requested. There have been some other examples. I know you've received some emails already. I have received emails. We will try to make that process a little bit smoother for you. We've actually created a Metro Cares Committee email that we will ask that to come through so you are not inundated with your personal email receiving those. And there's even been a request for additional community partnership funds within Metro. So we talk about community support maybe through a nonprofit, but again, our departments that work with the nonprofits, a lot of times those nonprofits are providing critical services that Metro otherwise would have to provide in-house. And so it's through a partnership and a grant to those nonprofits. And so there's even been a request internally for more funds. And then you'll see the different departments listed and an estimate of what they think would be additional expenses that they could incur that would meet the eligibility and would allow Nashville to be better prepared and respond. And then you'll see at the very bottom, there's just this idea of a potential reserve. One, because the $38.8 million is only an estimate, and we don't know what the coming months look like. Our recent weeks have not given us great confidence that this will be beat. We hear in the news, when we get into regular flu season later. So we think that a reserve of some amount is probably important to make sure that we don't, end up having to use general operating and general fund expenses, as well as They may change the length of the guidance. Right now, as I said, December 30th, and we're not sure why it's not the 31st, but it is the 30th, is the end of the allowable time period. And if they extend that, then there would be additional needs and opportunities past that date, as well as any other change in guidance that may come, or an increase in community need.
Sorry, I just wanted to make sure. So from community support on down, this has not been allocated. This is just what sort of has come through. But like, for example, fire at 28.4, I know that's a request of a lot of things, but these are still dollars. It's not just the 55.5 million. We've got all of this money to figure out who's getting what and how much and for what for, correct?
Correct. There's 55.5 million, but there's already, over 100 million in request. Yeah. So that's what the challenge is for this committee.
Yeah, just a question. For instance, I'm familiar with the Equity Alliance recommendations. So who put the 20 million
Those are
estimate
just
on that? Are they just
swags.
placeholders?
Yep, placeholders.
So there's no real work behind that to come up with what?
No, and we'll talk about
okay.
the Equity Alliance work before we go, and I know we're getting really close on time. And that's probably...
I had a quick question.
Yes.
I've heard that, there might be another round of federal relief coming, and I know the state has a big pot of money. Have we been given any indication on whether or not some of that might augment the money that the 121 million, or not?
I'm going to actually let Ashley answer that. She's a little more in tune with our state and federal.
Yeah, so there could be potentially more money, and we are working with the state to see what they're doing, and that's the reason we have Representative Love with us as well, because he serves on the committee for the state, and so hopefully that will be able to answer some of the questions. The last thing we've heard is the House and the Senate are very far apart on what they're willing to agree to. Part of it is if they're going to do an allocation of direct money to individuals and what that amount would be and who would qualify, and they haven't agreed. And so, we've heard several different rumors. I think there's been about 7 different bills so far at the federal level of what this could look like. So banking on them doing anything that we can rely on is a little iffy.
Really quick before we transition to the Equity Alliance, I understand the concept behind the question marks, but in terms of these other requests, is there details to that can be shared with us as the committee?
I could get more details. I have pretty good detail for some of the larger numbers, but because they weren't really approved, we didn't want folks going through. They haven't gone out to contractors and gotten bids. They haven't incurred expenses in order to come up with these estimates. So we certainly could, and if there's any in particular, it'd be helpful if you wanted me to get more detail. I'll go back to those departments. But yes, what you've got there is simply general requests that have come through, amounts that people have kind of said, it would be nice if we could. You'll see in the, could, and then fill in the blank, give 20 million, give 10 million to the, you'll see it's going to be more helpful on the electronic copy that I gave you, but those examples from other cities, if you click on those links, you'll see the news stories of how some of the other cities have been spending the funds. And a lot of when you see the community support, it really boils down to economic support to individuals and small business grants. So even if they say, it's tourism or arts or the music, you'll see most of it boils down to a small business grant.
Have received a detail of, for example, from Chief Swan for fire, OEM, and EMS. And so I know what that is encompassing, what they're requesting, and I did have some more questions that I wanted to be answered by that. But I think it would be helpful, for me anyway, for all of these requests, to see a detail of all of these requests.
Okay.
That would help me tremendously.
I don't know if I missed the amount. Did you say how much we had in the FEMA claim?
We don't know that number yet, but a preliminary review, I have already netted the fire and OEM. If you'll see, because we're working with some disaster recovery specialists right now that specialize in our FEMA claim, I had them look at that list from Chief Swan and said, which of these do you think FEMA would accept? And so we already netted that. And so those are actually additional amounts that we think would not meet the FEMA requirements. The biggest difference is that FEMA does not want you to have an asset at the end of the response. So they don't want you to lose money, right? They want to provide everything needed for the response, but you are not to be actually bettered by the, right. Really any kind of asset. They'll actually, there's a clawback. And so they will, even if it was a smaller piece of equipment and it was a $5,000 piece of equipment and you used $1,000, they're going to actually only allow $1,000 of that. They're going to say that $4,000 is still your asset.
Mary Jo, I don't know how close you are to getting into the action item about the Equity Alliance, but before we got there, I wanted to disclose that Equity Alliance declined mine. So I'm going to abstain from voting on anything related to them and just recuse myself from the discussion about that. It's not a legal conflict, but it certainly is the appearance of a conflict.
Excellent. I appreciate that. Thank you. So I will go there. As we talk about individual support in the community and to individuals, we have engaged the Equity Alliance to do a very thorough survey, in-person, knocking on doors, electronic surveys, a lot of data to find out where are the greatest needs in our community and what are they. And they will have their preliminary report to us. It's due to us the same day that the preliminary recommendation is due from this committee. So we have talked to Equity Alliance. They will give us a little bit of a preview with just a couple days. And that will drive, I believe, a lot of information for you to have to make recommendations regarding the community and the greatest needs. And so that's where, that is not the only source for individual support, but that is going to drive a lot of the work that we'll be doing. We believe those numbers are going to be greater than what we have. We'll be looking to the state and other funding sources to help with that work, but it's going to be an important piece for you to consider on that August 3rd date. Councilmember Gamble.
Thank you. I was just going to say that I believe that the Equity Alliance is doing great work, and I'm happy, pleased about that partnership, but also wanted to make sure that we are allowing review of other nonprofit organizations to help with this work, particularly the Urban League and other organizations that can help with the administration of rent assistance and other community support.
Yep. So I think what I'd like to do with, I think we're at time, but I'd like to make sure we have our next meeting scheduled. And that's really where we're going to start to talk about some of the structure of, we don't have to make the preliminary recommendation until August 3rd, but when we do that, we do need to have an idea of how do we want those funds administered? How do we want to go about an application process? Is that something we want in-house? We want to actually have third party, another nonprofit, a group of nonprofits administer those, and then as well as our small businesses, and not forgetting about that in the conversation, as well as then as we see other needs within Metro. So I don't know if this, we think every other week would probably be the right time frame, while a final recommendation cannot be later than November 15th per the ordinance. We would actually like that to be a shorter time period and maybe looking at September 15th. So maybe kind of that every other week between now and September 15th should really allow us to have a pretty good idea of what is coming at us.
Given the August 3rd date, that's would be what, 2 meetings between now and then. What exactly is the completed product that's expected on August 3rd as opposed to what we will be doing after August 3rd?
So I think if you look at the proposed outline, what it would be would be something along the lines of, how much do we want to earmark for community support? How much do we want to earmark for small business? How much do we want to earmark for more expenses within Metro? How much are we willing to keep in reserve? And then until what point? How late do we, when do we want to make the decision on that reserve? So I think the initial recommendation is going to be more at a broader level with kind of the dollars that we want in those different buckets, because that will then drive the next questions of then how and who. And so if we know what we want, if we say this is all community support, we're going to rely on the state for small business grants, then we're not going to have to develop a process for small business grants. But if we say we want to be part of that, then we have to develop a process. So I think until the committee makes that initial recommendation, then after that point, we'll be able to get into developing the process and the grant process and framework. Representative Love?
Yeah. Two things I think will be helpful. One, with relation to small business grants, if we discuss within this committee what parameters we want to place on that and what the requirement will be. For example, we allocated $200 million from the state to help 28,000 businesses, but that was based upon those who were tax-paying businesses. And so if we could talk about what we wanted to have done, it makes it easier to say, if you want to rely on the state to do more, then maybe we push those businesses to comply with what the state is asking to relieve us from having to do that. Or if we want to have a whole different requirement, I think it's important for us to discuss also, because you may have some businesses that don't have all of that paperwork together that the state requires and may need the support from Metro government directly. Just something for us to consider as we talk about trying to leverage as much as we can from the state levels, figure out what we want to do for small businesses in Nashville.
Absolutely. And I believe, Ashley, you put a list of
in the back of your packet on the right-hand side, there is I pulled it straight from the Treasurer's Office website. And so that way you can see the businesses that qualified. And then it also tells you how to estimate what you would have been given. They do not have the full list of what businesses received the funds, but you can see the types. And to Representative Love's point, if you were not registered with the state, you did not receive the funding, and it was a direct allocation into your bank account.
So one more.
Sorry to belabor the point. And the problem, though, that we discovered with the state was, if you opened your business in January and you had to shut down, you don't qualify because you had not started paying taxes yet. And so there still may be some businesses in Nashville that need that kind of help because they did open in January or February, but had to shut back down. So just something for us to think about as we talk about small businesses in Nashville, to get parameters on what we'd like to see done.
The other point, nonprofits had qualified for federal relief, but they did not qualify for the state. So you'll see that full list of who did qualify.
Okay, so looking at calendars, I don't know if we just got lucky with today's date working for everybody, or if we want to stick with Thursdays, if there's a different time frame, if 1 hour is enough, we want 90 minutes. Do we want to propose 2 weeks from today, same time?
I'm okay with 90 minutes. I feel like we need the time to do that, so I'm happy to allocate 90 minutes for sure.
Do we want to move it up earlier in the day, or is this time frame typically better? Do you want to?
I think 90 minutes is what we'll need, especially if we're trying to cover a lot of grounds before August 3rd, for sure. And this time works well for me.
So that would put us at July 30th, noon to 1:30. That work? All right. That's pretty good. Impressive. Thank you all for that flexibility as somebody's looking at their calendar, realizing they have to move something. I appreciate that. All right, we have our list of homework to do. If you have any questions, please don't hesitate to reach out to me or Ashley. And at that point, I will officially adjourn us and thank you again for your service.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.